It definitely cuts against most privacy principles that I've ever been aware of. You collect the data you need when you need it, and you don't just go vacuum up a bunch of data that you never intend to use. And I do think I'm a big fan of the sharing of social determinants data. It's reminded me of one of my favorite classes in public health school that was a real eye-opener for me around just how much what happens to you outside of medical care, just education levels, income levels, where you live, whether you have access to healthy food matters so much in terms of what your outcomes are going to be. It was very eye-opening to me. But we're looking at sharing this with healthcare systems that are not, and doctors in particular, that are not necessarily equipped to do anything about addressing those concerns. And yet we're working very hard to make sure that data moves in the way that it should. And I do hope that the catcher's mitts on this data are actually ready for it, and that we're not just flooding practices with a bunch of data that they're never going to use.